not that.
Good nutrition, obviously that's the foundation of your health, and we're in the business of trying to get children healthy. And so by recognizing the malnutrition and giving them the proper nutrition that they need, that can help improve clinical outcomes, it can reduce their length of stay in the hospital, and it can prevent them from being readmitted after they've been discharged.
We are responsible for coming up with the nutrition care process. What that is an assessment, it's a diagnosis, it is coming up with interventions and evaluations and monitoring.
We're clinical dietitians, so we need to understand the medical aspect of what's going on with the patient. We also have to understand what their treatment is, including medications. We also have to interpret labs. Using all that, we come up with a feeding plan. We track their growth, we track their weight gain, and we try to make their diet as palatable, as kid-friendly as we possibly can.
Registered dietitians are part of an interdisciplinary team. They round every day with physicians, they assess patients, and they determine the best methods of nutrition support for those patients.
We work with our pharmacists to come up with IV nutrition and support kids' electrolytes and vitamins, and then work with our speech pathologists if kids have any oral aversions or swallowing issues.
This is a good sign of muscle stores and fat stores for Megan.
The nutrition-focused physical exams are new. The importance of it is that we find deficiencies quickly, we address them in an appropriate manner, we communicate that to the physicians, and we provide family information about what needs to be done. I think we correct a lot of nutrient deficiencies much sooner.
We'll try the feed starting again tonight, and we can support them in different ways with nutrition, if that's by mouth, or sometimes we provide nutrition with feeding tubes, and then when the gut's not viable to tolerate nutrition, we do total parenteral nutrition, which is IV nutrition.
Oftentimes, the amount of calories that are in a standard formula are insufficient for healing as well as growth, and so recipes are created to provide the best nutrients for growth for infants.
We have a formula room that makes about 200 formulas every day.
We see how we organize it on our plate, right? I do a lot of education actually on healthy eating. I help with food allergies. I do a lot with infants, navigating breastfeeding and formula, different introduction of solids, and then the transition into regular foods.
You having any pain with the latch, Sherry? We begin by meeting every mother who plans to provide milk for her baby. They tend to need help initiating pumping if their babies are too ill to actually eat. We collaborate with the dietitians oftentimes as the baby progresses from not eating to starting to breastfeed, and helping tweak little problems so that baby is able to latch better and feed better and grow.
Megan, you did so good this month. I enjoy what I'm doing so much that I don't feel like it's work to me.
I love what we do because we get to watch kids that are going through really tough situations be able to thrive nutritionally.
I love what I do. I get to work with kids every day who love to talk about food, and I really love to talk about food too.